In today's deep dive explainer, we're looking at what you might call the absolute gold standard, the elite special forces against intracellular infections. We're talking about macrolides. Okay, let's just jump right into this. If your body is a battlefield, these antibiotics are the highly specialized operatives that get deployed when your standard infantry just won't cut it. They literally hunt down pathogens that try to hide inside your very own cells. So here's our mission briefing for today. First, we'll meet this special ops group. Then we'll look at how they completely sabotage the bacterial protein factory. After that, we'll break down their generations and members and witness their really incredible Trojan horse maneuver. Finally, we'll cover the necessary intel on safety and side effects and finish up with some dangerous interactions you absolutely need to know.
Section 1. Special Ops Group, Biological Agents.
Now, how do these agents fundamentally operate to secure the battlefield? Well, unlike some drugs that just blow everything up, macrolides are primarily bacteriostatic. What this means is their main tactic is to just freeze enemy reproduction. They stop the bacteria from multiplying, which buys time and allows your own immune system to come in and mop up the rest. However, and this is a really crucial point, they can actually turn bactericidal, meaning lethal on contact, if you deploy them in high enough doses, or if they're up against highly sensitive targets like Streptococcus pyogenes or Streptococcus pneumonia.
Section 2. Protein Factory, Mechanism of Action. Let's zoom in for a second. Think of a bacterium as a tiny, menacing little factory, constantly churning up proteins to survive and multiply. Step 1. The macrolide infiltrates and binds reversibly to a very specific piece of machinery called the 50S ribosomal subunit. Step 2. It physically blocks the amino acid chain from elongating. In microbiology, we call this translocation. It essentially throws a giant wrench straight into the factory's assembly line. And the result? Step 3. Bacterial reproduction just completely halts. No new proteins means no new bacteria. Simple, but brilliantly effective.
Section 3. Generations and members. Classification. So, who exactly is on the roster for this elite squad? They're actually categorized based on the size of their chemical structure, specifically their carbon ring. We've got 3 main groups. First, the 14-membered ring. This includes the original veteran, erythromycin, and the highly effective clarithromycin, which is super famous for its crucial role in wiping out H. pylori in the stomach. Then we have the 15-membered ring. That's essentially azithromycin, known for having a remarkably long half-life. And finally, the 16-membered ring, which includes spiramycin and jacimamycin. Spiramycin is particularly notable because it's actually safe enough to treat toxoplasmosis in pregnant patients.
Section 4. Trojan Horse, Targeted Delivery.
Now, listen to this incredible statistic straight from the pharmacological data. Macrolides can achieve a 10 to 50 times higher concentration at the exact site of inflammation than in the bloodstream. I mean, let that sink in. They don't just float aimlessly around in your blood, they actively swarm the specific battlefield where they're needed most. So, you're probably wondering, how do they manage this targeted strike? It's through a brilliantly deceptive Trojan horse maneuver. Drugs like azithromycin actually hijack our body's own immune cells, specifically the macrophages and neutrophils. They literally pack themselves inside these immune cells. When an infection breaks out, these immune cells naturally rush over to the site to consume the bacteria through phagocytosis. So the macrolide is basically using your immune cell as a biological taxi. It bypasses normal tissue defenses and strikes the infection directly at ground zero. Just an absolute game changer. Because of this unique ability to easily cross tissue barriers and enter cells, they have a very specific hit list. First, they're the absolute gold standard for atypical intracellular pathogens. You know, the sneaky ones that hide inside our cells, like mycoplasma, chlamydia, and legionella. Second, they take out gram-positive cocci like streptococci and staphylococci. This makes them a fantastic alternative if a patient happens to have a penicillin allergy. And importantly, they are the very first choice for combating major childhood infections like Bordella pertussis, which causes whooping cough, and Corynebacterium diphtheria. Translating this to the actual clinical battlefields deployed every single day, you'll see macrolides used across various major medical specialties. In the respiratory system, they tackle community-acquired pneumonia and chronic bronchitis flare-ups. In ENT, they handle acute ear infections and tonsillitis. In gastroenterology, like we mentioned earlier, they're standard issue for stomach and duodenal ulcers caused by H. pylori. And in urogenital health, they're a primary weapon against sexually transmitted infections like chlamydia. Section 5. Safety and side effects. Collateral damage. But this brings us to a really serious question. What happens when the cure becomes dangerous? We need to pivot here for a second and explore the potential for friendly fire within our own bodies when we use these powerful agents. The collateral damage can actually be quite significant if it's not managed correctly. First, there's gastrointestinal distress. Erythromycin is particularly guilty of this because it accidentally presses the stomach's motilin receptors. It's essentially hitting the body's nausea, vomiting, and diarrhea button, a side effect you see a lot when it's given as a syrup to kids. More gravely, though, we absolutely must warn about cardiotoxicity. Macrolides can cause the QT interval on an EKG to prolong. For elderly patients or those with low potassium, this can trigger a fatal heart arrhythmia known as torsades de pointe. Lastly, there's a serious risk of liver toxicity, specifically cholestatic hepatitis.
Section 6. Dangerous interactions. Chemical sabotage.
Whenever you're mixing chemicals, you always have to monitor the liver. The liver's cytochrome P450 enzyme system, specifically CYP3A4, is the most critical checkpoint here. Clarithromycin and erythromycin are strong inhibitors of this enzyme. This means they literally block the liver from processing other medications, which causes a massive, highly dangerous backup of those other drugs floating around in the bloodstream. There's a really stark contrast in the risks here that you need to take away from this. Danger. If you mix clarithromycin with cholesterol-lowering statins, the statins back up in the blood. This can lead to severe muscle breakdown, known as rhabdomyolysis, and acute kidney failure. It's a potentially fatal trap. But look at the safety side. Azithromycin, because of its unique 15-membered ring, hardly affects this liver enzyme at all. This makes it a much safer choice for patients who are taking multiple medications, known as polypharmacy. Which leaves us with this final, somewhat provocative thought. How do we balance deploying our elite biological troops while ensuring they don't accidentally sabotage the patient? Understanding the power, the stealth, and the very real risks of macrolides is what separates a truly great medical strategy from a disastrous one. It's a fine line between curing and causing harm. Thank you so much for joining me for this explainer, and keep questioning the science.